You had some excellent answers to the previous questions, Mr. Bishop. And now we have changed the scenery a little bit for another questions and answers. So the following question is, for whom are the courses in orthopedic medicine made? Is it for physiotherapists, medical doctors, maybe specialists? Well, what is your answer to that?
In fact, it is made for everybody who is interested in the disorders of the locomotor system and who wants to work in that field. Originally, Cyriax developed his courses for medical doctors and physiotherapists. From the very beginning, he wanted that they worked together as a team, and he found it as important for the physiotherapist to know about the diagnostic part as for the doctor. But in fact, now there is a lot of people working in the field of the locomotor system, and so it is interesting for all these people. And for instance, even everybody who is looking for a more standardized way of examining should be interested in this method. Probably when people have some experience in this field, they must in the end feel that there is a bit lack in their education on how to examine patients. And therefore even orthopedic surgeons, rheumatologists, people working in the field of physical medicine, and even osteopaths, naprapaths, chiropractors who feel that they lack something in their education can be interested into it. So it is open for everybody who is prepared to spend a bit more time in taking anamnesis, who is prepared to spend more time in doing a proper functional examination. And if you are prepared to do that, if you feel the need for a more structurized approach of the patient, then you should be interested in these courses.